Thank you very much. Now I can see everybody. Well, welcome everybody. We're very glad to have you here. And we are very excited and very grateful to the organizers of HARC. If Professor Michael Paciuolo is here, hi, Michael. We're very grateful to you for allowing us another year now to keep the discussion going on health literacy and digital health literacy, and allow our international group to join you all in this important discussion. We are here in a workshop. We have a little bit less than an hour, so we're going to try to make the most of it. This is a workshop, so we will be very interested in hearing from you and engaging with you. And in a moment, we'll tell you what the timetable is, so you know when that will happen. But in the meantime, I'm just happy to share my screen. And thank you all for all of you who have informed us of who you are or where you're from. I'm coming in from Tel Aviv. My name is Diane Levin Zamir, but I'm a Midwest girl. I'm a Chicago girl, so it's nice to see a lot of Midwesterners. Can somebody nod and say that you're seeing my screen? Okay, thank you. So this is a workshop that we're interested in not only presenting, but discussing with you and maybe building on an outcome that we can use and continue working on together. So we're here to talk about digital health literacy intervention. And in the context of challenges, we're looking for maybe standards that we can build together, understanding and seeing some examples of best practice and perhaps measures. So I'm here with wonderful colleagues, a group of distinguished experts, health literacy champions, which many of you know. As mentioned, I'm Diane Levin Zamir. I'm coming to you from Tel Aviv. I'm very thrilled that Professor Okan is here with us from the Munich University, and he'll be introducing himself as well. Professor Dr. Jill Rowlands, primary care physician and professor of primary care in Newcastle University in the UK, and Professor Stefan van der Broek from the University Catholique de Louvain from Belgium. We have apologies from Dr. Christine Sorensen, who was going to be here, but she's actually on her way to Taiwan to join the Asian Health Literacy Association conference, which you're all invited to join, which will be taking place on Thursday and Friday, which is hybrid as well. And you can also, if you have time to jump on a plane and get to Taiwan, you can even make it because part of it is also in person. Right. So what do we want to achieve? We're going to be very ambitious, and we're going to try to explore some methodologies for digital health literacy intervention throughout the life course. And we'll be highlighting some barriers and facilitators. We'd like to really go forward and think about discussing standards and criteria for best practice in digital health literacy intervention. We've done a lot of work in measuring and in looking at the evidence about needs, but we want to go forward and see what we can do about it. So this is the question about quality, and we're going to be discussing that when we go together. And we're going to reflect on some appropriate process and outcome measures, specifically for this topic. Maybe they'll be similar to others, and maybe we'll be able to come up with some that are specific. If you all could put your microphones on mute at this point, and you will be invited very shortly to open them up and discuss. So to go forward, this is the program. This is what we want to achieve. We're going to have just a few words now about digital health literacy as we see it. What does intervention mean? What does it look like? And we have three wonderful examples from our health literacy champions, who you'll hear from in a moment. We will mention also national action plans for promoting digital health literacy. We will go into breakout rooms at about another half hour, maybe a little bit less, and we will be together in 3 small groups for about 14 minutes to discuss a few questions that we have, that we're going to put to you, that we, of course, you're coming here to work, so we want you to discuss and think together about some questions that we think are important, that we think about, and think about what we do for digital health literacy intervention. We'll come back together. Each group will report. We'll wrap up, and we're not only recording this so that others that can't be here can can also experience this workshop, but we also want to make sure we're recording the results because we want to take it forward. So just as by way of definition, of course, there are different definitions of health literacy, digital health literacy, but we, for the purpose of our workshop, we've embraced the digital health literacy definition that comes out of the MPOL, the Measuring Population and Organizational Health Literacy Network, under the auspices of WHO. And any of you who want to see the full report on the HLS from 2019, 2020, just Google International Report, Health Literacy, MPOL, and you'll be able to see a very, very rich report. Within that, we have chapter 12, which is dealing with digital health literacy, measures, how we develop the measure. I won't go into it now, but for the purpose of our discussion, the definition is what you see here. We're looking at abilities, we're looking at skills of what is familiar to you all, accessing, understanding, appraising and validating and applying online health information. But not only, we're also looking at interactive health literacy in digital context, using the digital resources. And it can be, as we've seen now, it's just an explosion of different possibilities. So we have a wide definition, but we are looking at people's skill level and the way in which they're applying what they're able to do. And I also want to acknowledge my close colleague, Professor Stefan Vandenbroek, who together we led this part of the MPOL study. So why is this important? You probably can all answer this very easily, but just to make sure that we're thinking about probably the same points of importance, we know during the COVID pandemic all over the world, whether it's in Israel or Belgium or the United States or Boston or Texas or the UK or in Germany, everywhere and anywhere, social media really played an important part, whether it's promoting digital, the use of positive use of digital resources or perhaps not. We know that there's a lot of stakeholders, they're investing more and more. If you look at some of the marketing reports for health apps, you'll see that the way in which it's increasing very rapidly. And they're talking about well-being, they're talking about health. We're not sure yet how much evidence there is for effectiveness, but we also see that there's demonstrated feasibility and effectiveness for different health conditions in low, middle, and high income countries. We're interested in looking at this globally. And while they may promote health, some are, as we know, are challenged more, whether because of cultural barriers or other determinants, age. Some countries, age is a barrier, some countries it isn't. So these are the things that we're looking at, why it's so important. And we'll not go into this model, but you have the reference here. We've realized that it's not just a digital divide. It's not just black and white, whether people have digital health literacy or not. We realize it's an issue of context, whether it's issues of personal context or situational context or environmental context, individual skills, as we know. So there isn't any one determinant of digital health literacy, and there isn't any one for each person. It really does depend upon so many aspects that are influencing. So we're looking at the directions. We know there's two things that we usually say we can do. And of course, here we are again with Ruth Parker's model, which of course we could develop more and more, the depth, the breadth. But we know also for digital health literacy, we could be looking on the one hand, helping develop people's skills, empowering and working with them to develop skills in the community, in the family, digitally throughout the life course, and though some will be mentioned here. But also we're looking at organizational health literacy and capacity building so that organizations and systems will be providing better resources, more appropriate resources, more trustworthy resources, and accommodating people with a whole range of skills. So as we see, our classic model is here with us today as well. So I would like to firstly just to take a look at some really special examples of digital health literacy intervention. I'm really pleased to invite a close colleague, Professor Jill Rowlands, who will give us a really brief snapshot of something that didn't really work, but something else that really did. And then we're going to move on to two more examples, and then we're going to open it up for our breakout rooms and discussion. So thanks very much.
Yeah, thank you,
So
Diane.
Jill, I will push your slides. Is that okay?
Yeah, that's absolutely perfect. It saves me hitting my keyboard in a fruitless manner. So thank you very much. Yes, so let's go on to the first slide, please, Diane. So here's Ruth's model again, and it's shown so often because it's so good. So this is one of the two examples I want to share with you from the UK. So this was something that really hasn't worked at all. It's an example where you have demands and complexity of the system being well above the capacities of individuals, I would argue. So in the UK, everybody is registered with a family physician, and everybody has access to their electronic medical records. However, only 16.5% of patients actually use this service. Now, what we don't know is what, because the National Health Service has unsurprisingly not given us the breakdown of that, what we don't know is what's underlying that figure. What are the characteristics of people who do use this service, and what are the characteristics of people who don't? Next slide, please, Diane. But this is what I would hypothesize. So we know that there's a lot of social inequalities in terms of internet use, and those least likely to be using the internet are people with no qualifications or low qualifications, people in semi-routine or routine occupations, and those with a low income. So I would hypothesize that those 16.5% who have accessed their medical records with all the benefits that that brings, those are mostly going to be people who are highly educated, in senior jobs and with a good annual income, and therefore we know are actually far more likely to be healthy and have less need to access their digital records. Next slide, please, Diane. So that's something that I think hasn't worked. This, however, I think is a shining example of a digital health literacy intervention. So this widening digital participation programme was funded by the Department of Health and NHS Digital. Next slide, please. And it was delivered by a charity, the Tinder Foundation. So it ran for 3 years. It was designed for digital muggles. So for those of you who, unlike me, are not Harry Potter fans, I'm sorry about the explosions. It's Diwali, and I live in an area where we're blessed with lots of Hindu people, so they're all letting off lots of fireworks. Sorry about that. So, so this was designed for people who tend not to use the internet, the older people, people who are more socioeconomically deprived and who are part of marginalised and excluded groups. And the whole thing here was this was embedded within and developed with localities and had a focus on being self-sustaining, so teaching people to fish rather than giving them fish. Partnerships between communities, within communities, and then between communities and local providers, local IT providers, local health providers, local education providers. So altogether, over 200,000 people were trained, and everyone who was trained was asked to reach out to somebody else. And by the time you included them, you'd had outreach to near enough 400,000 people. And then within each locality, a group of local digital champions and volunteers were trained, and they're the people who were then tasked with sustaining this and taking it forward. Next slide, please. So when people were asked what sort of skills they developed, so over half of people were then confident to use the internet to find out about health and illness conditions, about how to evaluate their symptoms, and how to stay healthy. Again, over half said that when they needed non-urgent medical advice, now they would be confident to go in and look on the internet, whereas previously they'd have been coming to see family physicians. And again, over half of them had started to use the internet to support their mental health and well-being. Next slide, please. And following on from this and the lessons that were learned for this, multiple Pathfinder projects were run in other socioeconomically deprived parts of the country. Next slide, please. So what do I think we learned from these two examples? So I would argue that digital initiatives are much more likely to be effective if they incorporate health literacy approaches rather than designing something that suits the provider of the service and then they just make it available to everybody without working out whether or not people have the skills and confidence to use it. I would argue that a health literacy approach will tend to reduce rather than exacerbate social disparities and health disparities. And a health literacy approach, as seen in this widening digital participation program, can build functional skills, skills to read and count and understand numbers digitally, interactive skills to be able to talk with and engage with other people about it, and critical skills to be able to evaluate the provenance and safety of information that people have found on the internet. Final slide from me, Diane, please. So what does this mean for quality standards? I think all digital initiatives should incorporate health literacy approaches. I think these approaches should incorporate functional, interactive, and critical skills, that they should all be evaluated, and that evaluation should include looking at what has happened to social and health disparities. That's me. Thank you very much, Diane.
Thank you so much, Jill. I think you've given us a few points to base our discussion later that we'll have on equality and on standards. I think you've already kind of set the stage, and thank you so much for sharing the examples. So I'm really pleased to invite Professor Orkan Okan from Munich, from the university, where he's a shining expert on health literacy for children and adolescents, and has contributed so much to the research and to action. And he's here with us just for a few minutes of a presentation to look at what we're learning more and more about, particularly in the life course and particularly for children. So over to you, Orkan.
Thank you so much, Diane,
okay.
also for
Do you want me to stop sharing, or do you want me to push your slides?
Can you see my screen already? Because I just...
Yes.
And do you see it when I go through the presentation as well?
No, I think I have to stop sharing.
Okay, can I then please share my screen and go from there?
Oh, I think my screen has been stopped. So you go ahead. We're seeing your homepage right now. So
okay.
Go ahead and share.
Okay. Great. So again, thank you so much, Diane, for introducing me, and also to Michael Pasha-Orlov and all the other organizers for organizing the HARC conference. My name is Orkan Okan. I'm professor of health literacy at Technical University in Munich, and my niche in health literacy is health literacy research in children and adolescents, and in particular in schools. And this is the reason I'm going to introduce an example how to address digital health literacy in schools in countries where there is no health education, school health education in place. This is the case in Germany. Unfortunately, we don't have this kind of health education in schools, but I think what we have is a great opportunity, which I will be going to introduce. But first of all, we did some evidence synthesis, some literature reviews on health literacy in schools, and found out that health literacy is a very new concept to schools. Most of the teachers, the school principals, everybody involved, even the parents, they never heard of health literacy. In particular, in Germany, there is no mandatory curriculum on health education, health promotion, or health literacy, which makes it difficult. On top comes that there are even no policies, neither educational nor health policies, that guarantee that these kind of topics are being addressed in the classroom. So, and like Germany, there are other countries as well that don't have school health education, which really makes it difficult. And even if there would be, the teachers in Germany, they are not being trained when we educate them and we train them at universities in health topics. So that might be quite difficult to address health literacy if themselves are not trained in that topic. And on top comes that the school curriculum, since schools have the mandate to provide education, to train educational competencies, is already overcrowded. There wouldn't be no time to address any extracurricular topics. So these are the challenges and barriers that we are facing here in Germany, but also in many other European countries when we try to address health literacy in schools. And therefore, we have sought for possibilities, for opportunities, for door openers, how we can integrate, how we can address health literacy in schools. And in Germany, we have the strategy for digital literacy, which is mandatory. There is an initial budget of 5 billion euros available for all schools to update their infrastructure, to invest in software, to invest in teaching materials, etc., etc. And we are educating and training the teachers at our universities in digital literacy already. And since digital literacy in Germany sometimes also called media literacy, but conceptually it's exactly the same, are mandatory and so similar to health literacy, they offer an opportunity to address health literacy. And this is what you see here. This is the curriculum and competence model for digital health literacy or for digital literacy or media literacy. You see we have 6 competence dimensions, and 3 of them correspond to health literacy, and in particular also to Don Nutbeam's model of health literacy with functional, communicative, and critical health literacy. And by introducing health as a topic, because digital literacy teaching is not related to any topic, teachers are free to introduce any topic they want to address with. You can address health and then would have not digital literacy, but digital health literacy. And the good thing about this model, and also a requirement of our school system, is that everything that is being taught in school should be holistically. And here you can see, by addressing health literacy within this kind of competence model, we are also able to address things like using and operating media. So how to work with digital media, how to organize and handle issues related to data security, data protection, but also in relation to programming, problem solving, algorithms, everything that is necessary in today's digitalized world. So we have used this curriculum to develop a health literacy intervention for schools, which is what you see on the right-hand side. This has about 160 pages and addresses in many modules different teaching programs, teaching lessons for the classroom. The teacher can address it to teach, for example, health literacy in relation to the COVID pandemic, to sexual behavior and competencies, to mental health, to physical activity, nutrition, and many other things. And the good thing about that is if you keep in mind the barriers and challenges that I introduced, by using a curriculum that is mandatory already and teachers are trained in, of course, we overcome all these barriers. You see here, these are the barriers. And this is a kind of a win-win, because we don't need no school health education curriculum, but can use a different curriculum, just introduce the topic of health, and then we'll be able to promote health literacy without being or having any add-on or extracurricular activity to address or ask teachers to address, while they already don't have any time to address their usual topics that they are required to address. Yeah, and the good thing is you can use this kind of curriculum not only here in Germany, because the curriculum that we have developed in Germany is based on a European Union curriculum, and all the member states have also adapted that digital literacy curriculum to their schools. So this is an opportunity to have to introduce health literacy in schools very early on from grade 1, because this is when the curriculum starts, and this is also very much like using the digital initiatives that are already in place to strengthen health literacy. So you don't have to develop something from the scratch, but just analyze your setting and use what they offer. In this case, it's digital media or information literacy, which are very much related to health literacy. And last but not least, we are talking about quality standards. This curriculum, of course, the original curriculum that we are using, and we are very close to it. And this curriculum was developed by using certain didactics and instructions, validated content. It has defined the learning goals for all of the grades from grade 1 to grade 13, because in Germany, children go 13 years to the schools. The outcomes are defined, and there are also modules for academic teacher training. So when we address this topic in our teachings at university, when teachers attend our lectures or seminars, we will be able to prepare them. And since this is a school-based concept, it is also very easy to implement. Thank you so much. This was actually my last slide, and now I'm giving over to Stefan van den Broek.
Okay, so I'll just, I will share.
I have to see how I can stop the screen sharing.
Okay. And we're
going can you stop my, oh, there it is.
Okay, great. So I've shared my screen. Can you see it? Okay, thank you so much, Orkan. Can you also post a link to your curriculum? If you could put that in the chat, maybe not everybody can understand German, but I think they can get an idea from the way in which you designed it, get an idea and also learn about it. So many digital ways of having Google Translate now too. So thank you so much for that, Orkan. Again, question of standards, especially in school systems. Is it an oxymoron when we talk about regulating digital initiatives, because perhaps that's why the digital world has taken off so much, because there isn't regulation and aren't quality standards so much, and there will be, and they're beginning to be developed. So in the meantime, I'm really happy to welcome Professor Stefan van den Broek. He's a professor of public health psychology at the Universiteit Katholiek de Louvain in Belgium, who's done so much work on health literacy research, digital health literacy, chronic care. So Stefan, over to you for an exciting example that you're going to share with us right now.
Thank you, Diane, and it's a pleasure to be here and to be here or sharing with you from Belgium. Like Diane said, my university is the Université Catholique de Louvain near Brussels. You can see the picture behind me, unless I'm hiding it with my head. But I'm not going to talk about specific work from Belgium. I'd like to open up a little bit with an example from European collaboration. And it's also a project that looks at digital health literacy from the user perspective and trying to look at how people can be helped to make better use of the digital resources. So not on the provider side. It's a project called IC Health, a project that was funded by the European Union within the research program, the EU research program Horizon 2020, from 2017 to 2019. And it involved a number of countries, as is typical for these European projects. You can see the names of the countries here. Obviously, not all European countries participate. But the idea of this project was to really work on digital health literacy of European citizens and improve their skills. The idea of this project was that we would start by the people themselves, and we would work with the people to really ensure a fit between needs, possibilities, local conditions, and competences of people. And so in order to do so, we worked in a number of steps with first communities of practice we would create. And then with them, we would create a series of massive online open courses. We had a number of countries, as you can see. We had also had a number of themes that were represented. So we created courses for children, for adolescents, for pregnant and lactating women, for elderly, and then last but also not least, for people with diabetes. And so given the typical European situation, we were also taking into consideration the different languages that were spoken in the respective countries. So you see that this added another element to the work. So we would then test those MOOCs and look at their impact on health literacy, and specifically on digital health literacy. And then of course also with the idea that people would be more capable of self-managing. So that's what we tried to do. And then if I can get the next slide, Diane, then you can look a little bit at how the process of the project took place. I'm not going to go too much in the details, but you see that the very strong element on collaboration with people from the basic communities was important. So we looked at the situation of what's available, but then really engaged people from the population, representatives of the different groups that represented also the teams that we worked on. They were then asked to help us co-create those courses. They were then translated into actual courses made available online, and then we would work with them. So the idea of being them made available online and free, so that people would actually be able to improve their digital health literacy through working online and not necessarily needing people to be working with them on site. So you see the calendar, but that's probably not the most important part. I think we can go to the next slide. So in terms of results, there were, because of the various countries, because of the various themes, we had quite a few people who signed up for the co-creation. So there's some build-up effects here, Diane. You can actually just go through them a little bit. Yeah, thank you. So it meant that we had a lot of people times the different themes, and that resulted, of course, in quite a variety of product in the final version that would be made available in the different countries and in the different languages. So that's at the same time a strength, but also something which makes it more difficult, especially for comparison reasons. But what is important is that at each time, the courses were representing the different phases and the different elements of health literacy and digital health literacy. So more specifically focus on how to access information, how to understand that information, how to evaluate the validity, the usability, the correctness of information, the completeness, and how to then use that for working and taking care of one's own health. So it was a large variety of courses as such, but they all had this structure in common. So maybe we can go to the next slide. So I was involved, or my team was involved in the MOOC that focused on diabetes, and so the health literacy for diabetic patients. And so basically our module consisted of, or our course consisted of 5 modules. One was more an introductory one, and then the other 4 were representing the different skills for health literacy that are important. And so at each time, people would be allowed to work in their own pace on this, on mastering those skills, being taught, also working with examples, but also with small tests, so they could test themselves to see to what extent they mastered the skills or not. Unfortunately, I cannot show them now for you. They're also in different languages, so it would be a bit unwieldy, sorry, to show them all. But I think if you want to go to the site, you can find those, of course, if you would be interested after this presentation. So maybe we can go to the next slide, Diane. Yeah, if you can go to the next slide, actually. So evaluation was foreseen and also took place, but it was only a pilot evaluation. The actual larger rollout evaluation was unfortunately not included within the funding we received for this program. But so what we could do is, in a number of countries, not in all of them, we managed to make a test or to perform a test of to what extent participants would feel they develop their skills. And as you can see, that was focusing on the core aspects of digital health literacy, so finding information, understanding and appraising. And we do find some significant results. And what is also interesting is that the nature of the results and the size differs from one country to the next. So you can see that finding information changed significantly in Sweden, for example, and a little bit also in Spain, but not in Italy. Whereas understanding information was much more significantly changed in Italy and in Sweden. So I think it shows at the same time the complexity of of this kind of project, but also the necessity to evaluate at a sufficiently specific level, even if you want to do this in the context of a concept and of a conceptual approach that's similar across countries. So with this, I think I would like to hand back the floor because I think time is also running, but I'll be very happy to share that information with others in case anybody would like to have more information about this. There's some publications, as you can see, that share this information as well.
Thank you so much, Stefan. That was wonderful, very rich, very intriguing. And you brought up the issue of co-creation, which we're not doing enough of, or not discussing enough, or not researching enough when it comes to digital health literacy. So thank you for that. I will just make mention of the issue of policies that support and promote digital health literacy interventions. What is the role of policy? Is there global policy, international policy? Is it country policy? Is there a way in which we can get the politicians and the decision makers on board to promote quality standards and to demand quality for digital health literacy intervention? So this is just another aspect that we have to keep thinking about. Here's 4 examples of national action plans on health literacy, actually from outside the United States. We know the States is doing so much in this area, but you've got from Germany, from Scotland, which I think is their 2nd version, from Portugal and from Norway. And it's really important if you want to get resources to also be part of an action plan. So that's another aspect. So that's it from us right now. So now we're going to go over to our groups. We're actually, Jill, if we can send it for 10 minutes, we had assumed that we would have 15 minutes. We don't. So we're going to, we're a large group. We're going to just be divided automatically into 3 different groups. And each of one of us will be taking a group. Jill will be in group number 1. Orkan will be in group number 2. Stefan will be in group number 3. And I will be jumping from group to group. We're going to ask you to come back in 10 minutes. Please open up your cameras, open up your microphones, share some of your experience with digital health literacy interventions. Again, building on that skill level that we're talking about, the empowering people to use digital resources to their advantage and to their health. Discuss the need for quality standards. Do we need quality standards? Can there be quality standards? Can you propose at least one quality standard that we can come out of this workshop with and then build on it? And please come and report back to us. So with that, I'm going to stop sharing. Jill is going to be dividing us in a minute.
Yeah.
There you go. And we're going to, but please stay with us, stay in your workshop, and we'll be back together. We look forward to seeing you all back together in another 10 minutes.
Lovely.
So thanks so much. Here we go.
Right, so everybody should get automatically in a room. If I find that you're left in the main group, then I will allocate you. So here we go, and we'll see you all in 10 minutes. Are there people who aren't in rooms?
So those that will stay are just to stay. Are people, do we have to press join to go in to the rooms?
No, they should just join automatically.
Okay. So if not, would you like to go to the one?
People are going.
Yeah, go ahead. I'll stay with people here.
People are.
Yeah, go ahead into the group.
I think people should be going. Let's just move people into room 1. Okay.
So maybe in the meantime, we are going to...
should go to room 3. So it should happen automatically now.
Okay, well, go ahead.
Okay. Is there anybody here who isn't in a room who should be? All right, let's move.
I can work with them here if you like. So that I'll stay here, and if you want to go into group 1.
Yeah.
So we keep people engaged.
What I might do, Diane, is I can't see how
I think people are leaving room 1, so I think one of us has to go in.
Can I send you to room 1, Diane?
Yeah,
okay.
Unless you would like to go. Okay.
No, fine. I don't see how I can join. I'll join you in a bit if I can. Unassigned.
So welcome back, everybody. I think we're a bit ambitious for the 55 minutes that we were allotted, and I was so interested in hearing what you are just hopping from the group to group. Can we just get maybe 1 or 2 main messages from each group? I know some of you have to be in another session in another 2 minutes, so we're going to try to make the best of our situation, and I think we'll learn for next time. This is an exciting session, but we want to still keep it going. So Jill, from group number 1, can you give us 1 or 2 messages that came out of that?
Yeah.
Just the beginning of the discussion that you had.
Okay, so we've got 2 brilliant examples, and we'll start by sharing one from Carolyn, and then I'll bring Fletcher in to share something very important from her experience. So Carolyn, can I ask you to unmute yourself and just tell us about the initiative you told us about?
So I know that we're limited in time. So our patient portal is something that we're always looking to make more user-friendly for our patients. So to me, they're the things that we have worked on, although we've had no formal initiative with outcomes QI or anything like that. But our patient portal, we're constantly working on it to make it user-friendly, simple language, et cetera. And then we're also looking at our training and how we work with patients to help them understand how they access the portal. So when you're looking at standards, I think there's 2 directions to go. There's the actual digital standard digital piece that you're using. And then there is the train that goes along to it so that patients, families, consumers can use it.
Perfect.
Thank you so much.
Have I got time to ask Fletcher to share, or do you want to go to the others and come back to us at this time?
Yeah,
Diane?
why don't we just do a round to the other groups? Each group have at least 1 message, and then we'll see if we're allowed to stay on for a few more minutes, and we'll have a second round. Group number 2, I think this was Arkan's group. Would you like to share one of the main messages that came out of your group?
Yeah, it will be Hillary Holes who will be reporting from our breakout session.
Hi,
Thanks,
Hillary.
Orkan. Thank you. Would you like me to focus on one specific question or just kind of give like a synopsis?
Either a synopsis, or if you can, if there was one main recommendation that came out of your group that you would like to put on the table for us to consider when we sum up as far as a standard or a criteria for quality.
Okay, can definitely do that. So I think one of the biggest takeaways from our group was that a lot of people were mentioning, and this seemed throughout the group that this was similar in a lot of different organizations, that the individuals were receiving pushback from their kind of organization for wanting to institutionalize health literacy, as well as kind of a need for quality standards is to be able to simplify language. So a few of the recommendations that we had said as far as quality standards were to include individuals with low health literacy in developing tools. So that was kind of on the participation user involvement side, as well as making the quality standards accessible. So aiming at diverse populations and target group specific approaches. And one other piece of that was improving the information sources. So I don't want to say eliminating, maybe I'll say eliminating just for lack of a better term, but eliminating misinformation and disinformation from like accredited organizations, we'll say, and maybe just going to sources that are more accredited for information. So that was just a kind of a short synopsis of things.
Thank you. Well done. Well, again, accreditation. It's another point that we should be considering. Whether can we accredit, how we accreditate, and what will be the standards. Perfect. Thank you so much for that. And group number 3, Stefan's group. Is there? Yeah. Can you give us one of your main messages?
I'll pass the floor to Tom. Tom,
yeah. Thank you. So what we really came back with was we were talking about like phone applications and things like that. We had a physician that was trying to prescribe an app for one of his patients, but when the insurance companies won't reimburse for those. So we talked about what would the feasibility of having some kind of certification body for healthcare apps or things like that? Like, how do we get them to move past this is a good product to something that this is a good product that pays out? And then how do we identify ones that would not be good products? Like how the people could be using other applications that may not be worthwhile or helpful, or even could be detrimental to their health. And where do we draw that line, and how do we validate that they're good sources?
Yeah, and even just having it updated is a challenge, even when it is a good app. Well, great, that is really, really helpful to the issue of reimbursement, the empowering, and also supporting people so that they have access to good resources. Well, thank you all so much. I don't think we have time for any more because Michael asked us to already allow people to go into the next session, even though we're having a great session. So what we'll just do, just to wrap up, this is just a teaser because this has been so lovely. So maybe just really quickly, I'm going to just come back to our screen and thank you all so much for joining us. I'm very, really grateful to our presenters, to our speakers, our colleagues, the group discussion that was just taking off, and it was just getting off the ground. But I realized even 10 minutes, you see how much we could do, we could accomplish, but it wasn't enough. So we want to keep going, and we want to make sure that maybe next year in HARC we'll meet together face to face. That would be the best. So thank you all so much. Enjoy the conference. And I think maybe the chat will stay open. I'm going to stay on for another 5 minutes or so, if I will be allowed to, if they leave the session open. Anybody wants to give their contact details, wants to stay in touch, I'm going to stay on. So thank you all so much. Bravo. Good work.
Yeah, and I think the idea of looking to see if we can get back together next year, whether it's virtually or face-to-face, is a really nice one. So maybe people interested in that could put their details in the chat.
So let's call this part 1.
Yeah.
And then next year we're going to come together for part 2 and beyond.
Yeah, lovely.
Okay. Thank you all so much. Thank you, Stefan. Thank you, Jill. Thank you, Orkan. Thank you all. This has been wonderful.
Enjoy the rest of the conference.
Dinner time. Bye-bye, everybody.
Bye-bye.
Nice to see you all. Bye-bye. Diane, do you need me anymore? Or?
Always. Okay, well, thank you, Jill. Thank you for managing the breakout rooms. You always step up, and the more you step up, then I won't learn. So next time you have to say, Diane, you do it. You're too helpful. That's my digital health literacy challenge.
Yeah,
but I think it looks pretty. Yeah, it'll be good. Well, thank you so much. I'm just so anxious to hear more from the groups.
Yeah.
So I think Orkan has already left us, but so I'll see you all in a few days, I suppose.
Yes. Yeah, Stefan, we'll see you on Friday. Correct?
Yeah, well, it'll be Thursday morning for me, I think. But no, that's the other session. Yeah.
Yeah. So the session on digital. Well, we have 2 sessions.
Vaccination.
One is our session. One is on the digital session, and one is also Jürgen's session.
Jürgen's session.
On
yeah.
MPOL. So we'll be together. I'm going to get on a flight so that we can keep working together hybrid.
And tomorrow we have a whole day local meeting on health literacy. So it's Health Literacy Week for me as well.
Oh, perfect. Well, it's October. Good. Take care, everybody, and thanks again. Bye-bye.
Bye-bye.
Enjoy your day. Enjoy your evening.
Yeah.